All right, so it is now 10:02. And so we're going to go ahead and start the benefits and well-being presentation. First of all, welcome to the state of South Dakota as a new employee. My name is Kim Buck, and I am the Assistant Director of Benefits for the state of South Dakota. Next slide, please. So as we're going through this presentation, you are all on mute, but you'll notice at the bottom of the screen, you have a Q&A. You'll see a little icon that says Q&A. As we're going through the presentation, please answer any questions there. Between the benefits presentation and the well-being presentation, and at the end of that, we will stop and address questions live. Next slide, please. So let's talk about your benefits. Some of the things we're going to go over today is we're going to talk about some frequently used terms, health and prescription coverage, account-based plans, which include health savings, flexible spending accounts, and health reimbursement accounts, flexible benefits, which are your dental, vision, accident, hospital indemnity, and short-term disability, and then life insurance. Once we're done with that, I'm going to turn it over to Carrie Singer, who is also my slide presenter here as well, and she will go over the benefit well-being program along with our employee assistance program. So next slide, please. So plan year information. The state of South Dakota's fiscal year is from July 1st through June 30th. If you were hired after May 30th, 2021, your benefits become effective July 1. With the fiscal year running July 1st through June 30th, the benefits reset on July 1st. So our plan year also mirrors our fiscal year. For each year, for purposes of deductibles, out-of-pocket maximums, and eligible services, everything resets on July 1st. So this might be a little different than other plans you're used to that run on a calendar year. Next slide, please. So this is really important. You have 30 days from your date of hire to enroll for benefits. If you miss the deadline, you will be default enrolled into the Washington High Deductible Health Plan with employee-only coverage. You'll not be able to elect any flexible benefits, and you'll not be able to add any family members, i.e. your dependents, to the health plan or flexible benefits. So it's really important not yet. It's really important to get enrolled within that first 30 days. Again, if you miss that deadline, the only other time you're eligible to make changes to your benefits is if you have what's called a qualifying life event, i.e. you get divorced, you get married, you have a baby, or during our open enrollment period. Our open enrollment period is closed, so you wouldn't have an opportunity, like I said, to make any changes to your benefits, except for a qualified life event or during our open enrollment period, which will be May of 2022. So again, just really think about that as you're going through your enrollment. Next slide, please. So before we get into the presentation, I'd like to talk about some frequently used terms because sometimes people get a little confused, and if you don't work in benefits every day, these could be a foreign language. So coinsurance. Coinsurance is your cost of covered healthcare or prescription drugs calculated as a percentage. So for example, if you choose the Jefferson plan, the coinsurance amount's 30%. 30% is what you'd be responsible for paying after you meet your deductible on certain services. A copayment is a fixed amount you pay for covered healthcare services or a prescription benefit. For example, if a doctor's visit is a flat $50, that's the copayment amount. A deductible is the amount you must pay for most covered services before your health plan starts to pay benefits. An out-of-pocket maximum is the most you must pay for covered services in a plan year. So once you reach your out-of-pocket maximum in any plan year, the plan then will begin to pay 100% of covered services after that out-of-pocket maximum is met. Next slide, please. In-network and out-of-network providers. I'm sure people have heard these a little bit, but I just like to explain them a little bit better. An in-network provider is a provider who has a contract with your health plan and or flexible benefits administrators to provide services to you at a discounted rate. An out-of-network provider is a provider who doesn't have a contract with your health plan or flexible benefits administrator to provide services to you. So here I like to give a little example. And basically think of it as a contract. So An in-network provider, let's say you have to go to the doctor because you have a sore throat and you need to get it checked out. That in-network provider has a contract with one of those administrators to charge a flat $100 for that service. And again, I'm just using very generic numbers. It might not actually be that much, but for the sake of easy math. So let's say it's $100, and let's say you've met your deductible. Under the in-network provider, the plan, if you're on the Jefferson plan, the plan would pay 70% and you'd be responsible for 30%. So that charge is $100. You would pay $30, the plan would pay the other 70. If you go to an out-of-network provider, that would still be covered, but that out-of-network provider can charge you whatever they want to. So let's say you go for that same doctor's visit and that provider charges $200. You'll still have coverage, but it will be at the in-network rate. So what that means is in the same scenario, the plan would pay $70. You'd be responsible for the $30 coinsurance, but also anything over and above that contracted rate. So in this instance, you would be responsible for $130. So I just like to give that scenario because again, people kind of don't understand what the difference is. You still have coverage on most services. However, you're going to be charged a more out of pocket because that non-network provider doesn't have that contracted rate. Next slide, please. So now let's talk about HSAs. And again, these will make more sense as we move along. So what is an HSA? An HSA is a type of savings account that enables eligible members who are enrolled in a high deductible health plan to contribute pre-tax dollars to a savings account, which helps you pay for out-of-pocket eligible medical, prescription, dental, and vision expenses. You can only contribute if you are enrolled in a high deductible health plan. Contributions to this account can be made from you and your employer. The nice thing about an HSA is the money is always yours. It rolls over from year to year. So if you make an election and maybe you didn't have as many expenses as you thought, that money remains yours forever. Even if you leave employment with the state, that money is always yours and you can choose what you want to do with it at that point. It's important to note that any of these account-based plans that I'm talking about, they are governed by IRS regulations. So these rules are not made up by the Bureau of Human Resources. These are rules that are IRS mandated. Next slide, please. So what is a medical FSA? A medical flexible spending account is an employee-only contribution savings account. It allows you also to contribute pre-tax dollars to a savings account to pay for eligible medical, prescription, dental, and vision expenses. There's a difference with this one. This is a use it or lose it account. You have until September 14th of the current plan year to incur claims. Or if you leave employment, claims incurred while you were actively employed. So let's say your benefits begin July 1st and you've elected an FSA. So from July 1st, 2021 through September 14th of 2022, you can incur claims and submit those claims by a deadline of October 28th. However, if you left employment in January 15th, you would only be able to submit claims that were incurred from July 1st through January 15th. So it's really important to think about that as you're budgeting for a medical FSA, if that's the route you decide to go. A medical FSA can be used in coordination with a low deductible health plan. If you are enrolled in a high deductible health plan with an HSA, this account will function as a combo FSA until you meet your deductible. So some people who choose to go to a high deductible health plan choose an HSA because they know maybe they have a lot of expenses. Maybe they have a child who is getting orthodontia, and we all know that costs, a lot of money. If you elect an FSA and you also have an HSA, you can only use the flex spending account, the medical flex spending account for dental and vision expenses until you've met your deductible on the high deductible health plan. Next slide, please. So what is dependent care FSA? A dependent flexible spending account is an employee-only contribution account as well, just like the medical FSA. It allows you to contribute pre-tax dollars to a savings account to pay for eligible dependent healthcare costs. Notice I say healthcare costs. Oh gosh, I'm sorry. I just updated this presentation yesterday. It's for, ignore the healthcare costs. It's for dependent daycare expenses. So if you have a child age 13 or under who maybe goes to daycare or has daycare expenses, you can set aside up to $5,000 per household to help offset those costs. And again, I apologize for that typo in there. This is a use it or lose it account, just like the medical FSA. You have until September 14th of the current plan year to incur claims, or if you leave employment, claims incurred while you are actively employed. Next slide, please. Next slide, please. Okay, sorry. What is a health reimbursement account? And these will all start to tie in when we start talking about the health plans. And Carrie talks about certain incentives. A health reimbursement account is an account that is an employer-only contribution. So you cannot actually contribute to an HRA. With an HRA, if you receive reimbursement in there, you can be reimbursed for eligible medical, prescription, dental, and vision expenses. This is also a use it or lose it account. You have until June 30th of 2022 for the current plan year to incur any expenses, or if you leave employment, claims with incurred while you are actively employed. This does not roll over from year to year, and it's similar to how the medical and dependent care FSAs work. Next slide, please. So we're going to talk about health and prescription coverage. So first I want to talk about our provider. Our health and prescription coverage is administered through Wellmark Blue Cross Blue Shield of South Dakota effective July 1st. There are 4 plan options offered under our plans: 2 high deductible health plans, 1 low deductible health plan, and a no deductible health plan. In addition to a comprehensive network of providers, Wellmark administers the prescription benefit through CVS Caremark, offers a broad array of services and tools to help you navigate your healthcare, and provides care management and pregnancy support services. Next slide, please. So Wellmark Blue Cross Blue Shield has 120 employees located in Sioux Falls. Over 386,000 South Dakotans carry Blue Cross Blue Shield. And there's the largest provider network in South Dakota. 100% of hospitals and 95% of doctors in South Dakota are covered as in-network providers. If you go, let's say you're traveling, the other nice thing about Wellmark is they actually have out-of-state network providers. So if you're traveling out of state, Wellmark actually covers about 95% of hospitals outside of the state of South Dakota. So even if you're traveling on vacation, or maybe you're an employee who's remote working and you live outside of the state of South Dakota, you should be able to find a provider within the Wellmark network. And when we get to the end of this section of the presentation, I'll show you where to find those resources. Next slide, please. The other nice thing about having Wellmark is there are some enhanced benefits to help support you and your family. There's a Be Well 24/7 hotline that offers access to health professionals to help answer health-related questions to you. Who doesn't love a good deal? There's a Blue 365 portal on the My Wellmark site, and it offers you access to discounts from fitness trackers to gym memberships. It has cookbooks and cooking classes, even things such as contact lens discounts available to you to help you live a healthier lifestyle. And then there's the My Wellmark portal. The My Wellmark portal allows you to track your healthcare costs and gives you tools and resources at your fingertips. It allows you to see where you're currently at with your deductible and any covered members under your deductible, along with where you're at on your out-of-pocket maximums. You can also view explanation of benefits, look to see why a service is covered or not covered. It's a great tool, and we'll be providing tools on that after July 1st. Next slide, please. So now let's talk about the different healthcare plans available to you. First, there's the Washington Plan benefit. The Washington Plan has a zero employee premium. However, there are still premiums for dependents. On the Washington plan, there's a $5,500 deductible for single coverage and an $11,000 deductible for 2 or more members. With this plan, your out-of-pocket maximums are the same as your deductibles. So let's say you have single coverage. Once you've met that $5,500 deductible, you've also met your $5,500 out-of-pocket maximum, and all covered services and prescriptions will be covered at 100% for the remainder of the plan year. There's no coinsurance. With the Washington plan and with all of our plans, preventative services are covered at 100%. So with this, you pay the full cost of prescriptions, office visits, and other medical services until the deductible is met. As we're going through that, though, it's important to remember that, again, if you go to an in-network provider, they're at negotiated discount rates. So you'll be paying those network rates for those office visits and other medical services. As I said, once the deductible is met, the plan pays 100% of healthcare costs. And this is also HSA compatible for those who qualify for an HSA. Next slide, please. As we start to move through these next 3 plans, each of these plans does introduce an employee premium, or what we like to call a buy-up. So really think of it as you're paying an employee premium to purchase a more rich, robust health plan, just similar to as you would with like auto insurance. These are value-added plans, and we will keep going through these. So on the Lincoln plan, there is an employee premium. That employee premium, with that, on the Lincoln plan, it's a high deductible plan, but it offers a lower deductible. So it's a $3,000 deductible for single coverage or a $6,000 deductible for families. There's an out-of-pocket max of $6,000 for single coverage or $12,000 for family coverage. The Lincoln plan offers a mix of coinsurance with co-payments for certain prescriptions. Preventative services are also covered at 100%. And once anyone in your family reaches the single deductible, the plan will begin to pay allowable charges for that member. Prescription drug costs consisting of co-payments and coinsurance. Prescription drug costs consist of co-payments and coinsurance, and some generics are also covered at 100%. This is also HSA eligible for those who qualify. Now, I know we're going over this at a very high level, but again, I'll be showing you some additional resources to delve deeper into these plans. This is more, again, for the sake of time, I could spend all day going over these benefits, but again, just trying to give you a high level overview. Next slide, please. The next plan we'll talk about is a low deductible health plan, and this is called the Jefferson plan. This also has an employee premium. With this plan, there's a $1,750 deductible for single coverage and a $3,500 deductible for families. The maximum out of pocket when the plan begins to pay 100% is $4,000 for single or $8,000 for families. There is a mix of co-payments and co-insurance with this plan. So when I show you where those resources are, you'll see that certain items like a doctor visit is going to cost a flat co-payment amount, while other services may be a co-insurance amount, specifically inpatient and outpatient services. As with all of our other plans, the services are covered at 100%. And like I said, there's set co-payment costs for office visits, urgent care visits, and emergency room visits. All prescriptions are on co-payments, and this one is HRA and FSA eligible. Next slide, please. Next slide, please. Thank you. The Roosevelt plan also has that employee premium, but the Roosevelt plan is a very unique plan. There is a $0 deductible for the Roosevelt plan. It's an all co-payment plan, so every service has a set co-payment amount. It also has a max out-of-pocket of $4,500 for single coverage and $9,000 for families. Just like the other plans, again, preventative services are covered at 100%. There are set costs for office visits, urgent care, emergency room, and inpatient and outpatient visits, along with pathology and radiology. Really, everything on this plan is a co-payment. All prescription drugs are co-pays, and this is HRA and FSA eligible. Next slide, please. So some of the eligible preventative care that we discussed include scheduled immunizations and vaccinations, pregnancy care preventive screenings, annual wellness preventative exam, cancer screening procedures, i.e. those preventative screenings such as mammograms or PSAs, colonoscopies, that type of thing, and then well child care. If they meet the guidelines for eligible preventative care, they are covered at 100%. Next slide, please, with no co-payments or co-insurance. As we started introducing these plans back in April, we had a lot of people ask if they needed to choose a primary care provider for the low deductible health plans. And the answer is no. You do not have to designate a primary care practitioner. For the purposes of copays, PCP, primary care physician, refers to general and family practice, internal medicine, OBGYN, pediatricians, nurse practitioners, and physician assistants. Non-primary care practitioners are specialists such as dermatologists, oncologists, and cardiologists. They're not defined as a primary care practitioner, and as such, on the copay plans will result in a higher office copay because they are considered a specialist. Next slide, please. So let's talk about flexible benefits. With our flexible benefit program, next slide, please, sorry. We offer a wide array of flexible benefits. We offer dental insurance, and that's administered through Delta Dental of South Dakota. There are two plans offered. There's a base plan and an enhanced plan. Both cover the same services at different levels. Routine exams, and that's what reflected in the premium price. So as an example, if you go have that routine exam done and you're on the base plan covers 75% of those charges. On the enhanced plan though, which again is reflected in the premium, those routine examinations are covered at $1,000. The nice thing that begins new in fiscal year 2022 or July 1st of 2021 is that the state is now subsidizing your premium, regardless of your coverage level or plan level, and an amount of $16.20 per month. Please note that when we show you where to find the premium rates, that the $16.20 per month is factored in to the premiums listed. So we've had some people come back and say, well, this says $16.20 a month and it looks like I'm on single base plan and that's $16.20 a month. Does that mean I pay zero? The answer is no, because again, when we publish the rates, that's factoring in those subsidy levels already. Next slide, please. We also offer vision insurance, and that's through iMed Vision Care. Covered services include frames, exams, lenses, and contact lenses. Eligibility for services will be reset July of each plan year. For example, if you buy glasses in May, you can get another pair in July because our plan year starts July 1st. One thing that I want to make people aware of is if you are on one of the health plans, any one of the health plans, and you have covered members, the health plan includes one free eye exam per year. However, it does not include any contacts, exams, frames. I'm sorry, it does not include frames, lenses, and contact lenses. So again, that's something to think about as you're making your benefits change, is that you do not have, we do have eye exams covered under the health plan as well. Next slide, please. So let's talk about life insurance. Under MetLife, if you're benefit eligible, regardless of whether you choose to enroll in any of our plans or not, the state provides a $25,000 life and accidental death and dismemberment benefit to you. As a new hire or at any time, you have the option to purchase supplemental life and AD&D at 1 to 7 times your annual salary, up to a maximum of $1 million. However, there's something called guaranteed issue. So during your initial enrollment period, you can elect up to 5 times your salary, not to exceed $400,000, and you're guaranteed that coverage in that amount during your initial enrollment period. For amounts at 6 or 7 times your salary or in excess of $400,000, evidence of insurability is required by MetLife. Additionally, if you increase your supplemental life in any amount after your initial hire period, you will need to complete an evidence of insurability. So let's say right now you enroll and you say, I just want 1 times my salary. And then next year, maybe you have a baby and you get married and you say, well, now I need more life insurance. If you elect a higher multiplier, i.e. like 5 times your salary, you will be required to complete evidence of insurability. Finally, if you purchase supplemental life, you may also select to purchase dependent life as well. Next slide, please. Oh, I think we went, there we go. MetLife also provides short-term disability to our employees. It pays you 70% of your weekly salary, not to exceed $1,200 per week. If you're ill, oh, I've got to fix that. I forgot to do that. If you're ill or it's supposed to be YOU'(RE), ill or injured on or off the job and are unable to work for more than 7 days. With this policy, there is a 6-month waiting period after you enroll. So if you enroll for July 1st, you actually cannot use this benefit until January 1st. Short-term disability also coordinates with other payments you may be receiving from the state, such as paid family leave or workers' compensation. So to give a quick example of that, let's say you are out of work because you injured yourself and it's a workers' compensation event. With regards to that, workers' comp generally pays you 66% of your weekly salary. If you're receiving workers' comp and you have short-term disability, the state pays you that 66%, and then MetLife would coordinate that, and you would only get an additional 4%. However, if you're ill or injured and it's not work-related and that type of thing, it does not coordinate with like I said, it coordinates with benefits received from the state or payments received from the state. But if there's no payments available to you, say you're a new employee and you don't have any sick time, it just pays you that 70% of your weekly salary. Next slide, please. We also offer accident and hospital indemnity through MetLife. Accident insurance provides you with a lump sum payment to help with costs related to a covered injury. It does not coordinate with your other benefits. The payments are made directly to you. So they're not looking at what the insurance paid. They just pay you a lump sum amount based on the type of injury you receive. We also offer hospital indemnity, which also provides a lump sum benefit for hospitalization and associated treatment. Just like the accident, it does not coordinate with other benefits. The payments are made directly to you. Under the hospital indemnity plan, if you're hospitalized or or if you have a covered dependent hospitalized, there's a $200 per day benefit for regular inpatient hospital care and $400 for ICU care. Again, does not coordinate with any other payments, health insurance, et cetera, received. Next slide, please. So again, we went over this very, very quickly. We want to make you aware of a tool we have called ALEKS. ALEKS is a fun, easy to use interactive online tool, which asks questions, which are 100% confidential, to help you decide which benefits may be best for you and your family. I strongly encourage you to use ALEKS because you can put in different scenarios. It's going to ask you how many children you have. Do you take any sort, do you take medications? Do you expect to have regular or specialist visits within the year? And it does help guide you to which maybe one of the 4 health plans and or flexible benefits might be right for you. Next slide, please. As I said, there are additional resources available to you. Those resources are available on the bhr.sd.gov website. And again, that website is bhr.sd.gov. You're probably familiar with it because that's where your online application goes. But there's a benefits guide on there, which offers much more detailed information that I provided today. You can find out if your doctor is in network. It talks about Doctor on Demand, our virtual video, where you can have a virtual doctor's visit. You can check your prescription. There's plan design matrix that help you look at things side by side. There's a prescription comparator tool. So as you go to enroll for your benefits, or if you haven't already, I would definitely encourage you to look at all those different resources on the bhr.sd.gov website under benefits, because again, they're going to give you much more detail than I'm able to give you in a 30-minute presentation. Next slide, please. Please contact, if you have questions after this presentation is over, you can talk to your human resources specialist or contact the benefits department. Our phone number is 605-773-6027, or you can email us at benefits website at state.sd.us. This presentation does get recorded, and all of that information is also in that benefits guide on how to contact us. So I'm going to pause here for a moment, Carrie. I see we have a couple of questions. Someone, Victor, asked, hi, I missed part 2 SDRS is still available online, correct? And that should have been recorded with the SDRS. If you have questions on that, you would want to reach out to Michelle Deo-Amende. She is probably the one that hosted that session, and we would need to reach out to them. Jen W. asked, do we automatically get an HRA account, or is that something we need to request from our employer? Carrie, do you address HRA contributions and eligibility in your section?
I will talk about HRA. Currently, the only HRA contribution that our state employees receive from the state is through the Wellbeing Program, and I'll talk about that in a moment.
Okay, great. Thank you. I will let Carrie address that then at that time. Jen asked the same question, so I'll go ahead and just skip over that one. She asked, is the Washington plan also a situation where once any one purchase reaches the single deductible, the plan pays the balance after that for that person? And that is correct. So that is, it's an embedded deductible is a fancy way to say it. And we actually have a video on embedded deductibles on the BHR website. So let's say you have 3 people covered under your plan and one person maybe has more expenses than the other, and they reach that $5,500 deductible right away, or early in the plan year, or by themselves through prescriptions and doctor's visits. Then once that person reaches that single deductible, their benefits will pay at 100% for the remainder of the plan year for that person. And then Lisa asked, how do new hire employees get notified to enroll for their benefits? And that currently is being sent out via a primary email address, via our Inforce system. However, we are currently, as we speak, working on getting the new hire information updated and instructions provided on the BHR website. So we're hoping to have that wrapped up, Lisa, by end of day tomorrow. So I don't see that there's any more benefits questions. So I am going to drop off, and I'm going to turn this over to Carrie Singer. And she is our Wellbeing Program Coordinator, and she'll talk to you about the Wellbeing Program. Thank you, everyone. And don't forget, if you have any questions afterwards, you can reach out to any member of our team.
Kim, I have one quick question for you. The
Yes.
HRA, is that also used by the Our Healthy Baby Program?
Yes, it is.
Okay, thank you.
Yes, thank you.
So just to clarify, when we talked about that health reimbursement account, I had said that the only way that you would receive that is through the Wellbeing Program. And I will talk a little more about that, but also we have a pregnancy support program where you could be eligible to receive HRA money. So thank you, Kim. And I'm going to go on to the Benefit Wellbeing Program. This is part of your overall benefits package. And as a state employer, we really want to make sure that all of our employees are living their healthiest life, that you can be your best at work, at home. And a lot of the programs that I'll be talking about are going to support that, your well-being. So here's our logo. This is the Benefit Wellbeing Program. And again, we are focused on be well, work well, and live well, and supporting you as one of our employees. So just a quick overview of some of the things that I'll be talking about. We do have a reward for participating and meeting certain qualifications within the Wellbeing Program. It is completely optional, but certainly something you want to be aware of, and I will share that information with you so you can choose to participate. We highly encourage it, not only for the reward or the incentive, but also just for the other benefits that you can gain. We have on-site health screening options. We have an online portal. We have a brand new benefit well-being portal coming soon. And then we have a conditions management and Wellmark care team that will start July 1, as well as a new employee assistance program. So lots of things that are in the works that are going to be starting July 1. And I'll be talking a little bit about some of the current programs, because I know we still have a few weeks left in our program year before everything switches over in July. So why do we support employee well-being? All of these reasons listed on the screen. Better employee relations and morale, reduced absenteeism, enhanced recruitment and retention of healthy employees, and ultimately, we hope also lower healthcare costs, not only for you, but as for us as well as the self-funded state health plan. So why support well-being? I apologize that header should be, here are all the vendors that we work with to support your well-being. And we like to share these so you can be familiar with these names. But like I said, a lot of these things are changing come July 1st. But until then, we are working with the Stay Well Wellbeing Program or portal. We have a health management partners. I'll talk more about what they do. And then we also have KeyPro as our employee assistance program. It is possible that you may need any of these services prior to July 1. So I do want to speak to those before I talk about the new programs as well. So, we have a very short time. This is going to be a very high level overview. But as we start July 1, we will have lots of lunch and learns and other opportunities, information in our newsletters, etc., to update you on some of the changes. So these are some of the terms or the vendors that we work with that you'll want to be familiar with over the next couple weeks. So again, some of the opportunities available: health screenings, a new portal experience, lifestyle health coaching, learning opportunities and challenges, as well as an incentive for participating. Where do you find information about this program? So like I said, this will be a high-level overview, but it'll be really important that you know where to find information and be responsible for keeping up on any updates and access to those resources. So as Kim mentioned, bhr.sd.gov is the website where you would go. In the middle of the top of the page, benefits is the tab you would click on. And then when you get to the next page, benefit well-being is over on the left-hand side, and that will take you to all of our benefit well-being program information. So currently, the program is just winding down for this year. And like I said, our new program starts July 1. So for the benefit well-being program, the website is not been updated yet for the next year's information. And there's really no benefit right now for you to go out and check out the well-being program, because everything is kind of in flux until the new information comes out July 1. So just mark your calendars to check out that information come July 1. So a little more information though about the benefit well-being portal and what you will find once you get there. So like I said, the portal is closed, and it's closed or closing in the next couple of weeks. And then it will reopen. We're looking at an August 1st open date. But once you get there, you will find a customized portal experience based upon a health assessment questionnaire that you'll fill out. And then you can customize that portal based on your particular interests and activities. You can connect a fitness device and track your steps, track your variety of health information to load into the portal, and that can also help you earn points or earn the incentive. There is lifestyle health coaching that is available immediately. So if that's something you're interested in and you don't want to wait for our new portal to open, you can also contact our office for that information. It can be very helpful to have a lifestyle health coach just to check in periodically. They can call you once a week, they can call you once a month. or once a quarter, just to check in. And if you want to work on certain goals, they can help you identify what goals might be reasonable and give you some strategies to meet them. Lots of learning opportunities will be out available on our portal, as well as team and individual challenges. We have some great tracking tools, including a daily habit tracker, because we know that sometimes habits can be the way to get yourself on track for a healthier lifestyle. There's lots of tools and resources based on your special interests. And like I mentioned, also an incentive for participating. So one of our primary services that we provide is a health screening. And we have lots of reasons why we provide these and make it convenient to our employees. We feel it's important that you know your numbers and understand what they mean. So the items listed on your screen are the numbers that we do collect during an on-site health screening. Again, these are totally optional. There is no requirement for this, but there are incentives attached to a variety of offerings that we have. If you can keep your numbers within a healthy range, you can certainly greatly improve your health or maintain your health, as well as reduce your risk for disease. And we really try to catch things early and help you manage your health. And again, there is an incentive for participating. We have been told by several members that the health screening was able to help them find an issue with blood pressure or their blood glucose that was required them to check it out with their physician, and they really felt that the health screening helped them prevent any serious issues based upon their numbers. So there's two options that you can participate in this optional health screening. We offer lots of on-site screening events across South Dakota. Typically, those are offered between August and February. Limited, of course, depending on the size of your community. And in our larger communities, we offer multiple dates and times. So that list will be published probably in July or August. Once that portal is up and running, you'll be able to go out and actually register for a health screening. And again, check back to our website for updates on when those will happen. The other option is going to your annual wellness preventive exam. As Kim mentioned, everybody has free preventive care through the health plan. No matter which of the 4 health plan choices you make, you will all get an annual wellness preventive exam at no charge. And you can have them complete a physician form, which will be available on our website. And if they complete that form and you, as the employee, submit that form as a part of the wellness program, then you can meet the health screening qualification if you choose to participate and want to earn the incentive. So 2 options to participate. The annual wellness preventive exam is a really important thing to take advantage of, since it does not cost you anything. And it's a good way to, again, stay on top of your health and prevent any future health issues. So what are the well-being qualifications and rewards? Again, this is a high-level overview, and more information will be coming out about this, but the deadline to earn your rewards is April 1st, 2022. Both the employee and the covered spouse must complete for the employee to be eligible for the rewards. Watch for information in July regarding the new portal and the new program year reward and opportunities. It's really important for you to earn any reward. You must enroll in the new portal and complete the qualifications. So through the variety of opportunities that we will have and we will announce next month, you will have a chance to earn up to $900 in either a health reimbursement account, an HRA, which we talked about earlier, or a health savings account, HSA. And as you remember, this depends on which health plan you select. So Kim had mentioned that the 2 high deductible health plans are compatible with an HSA. So if you complete the wellness qualifications and you choose one of the high deductible health plans, you will receive this $900 or whatever amount you earn in a health savings account. If you were to choose a low deductible health plan, the low deductible health plans are not compatible with a health savings account due to IRS rules. Therefore, you would receive the $900 in a health reimbursement account. And remember, the health reimbursement account is tied to some deadlines and timelines as to when you have to spend those funds, whereas the health savings account will carry over from year to year. And just note the qualifications or incentive are subject to change, always based upon budget and other things in state government that we have to follow. But our plan right now is to offer this $900 reimbursement or $900 contribution to either an HRA or an HSA. And just a little bit more information about this. I didn't want to include a lot of detail because, like I said, it's really being released in July, but since we're really close, there are two categories where you can earn rewards. So the first will be to complete that health screening and an online health assessment questionnaire. Just by completing those two things, you would receive $500 in one of these accounts. And then after that, you have an opportunity to do all kinds of different wellness activities, choose what you like to do, and you can earn points, which then will relate to dollars, and you can earn an additional $400 by earning wellness points. And again, that equals a total of $900 potential dollars that you can earn. So that just kind of gives you a perspective of what you need to do to earn those points. And then, like I said, more information will be coming out. We'll have a lunch and learn in August, just about the well-being program, and that'll be kind of your introduction to the program. So beyond the benefit well-being program, there are other programs that are really kind of preventative or really providing services to help you manage your health. And currently, the Health Management Partners provides conditions management, case management, and the Our Healthy Baby program. And I'll talk more about each of these programs, but here is a number where you could find out if you qualify for any of these options as I provide you more detail. The Conditions Management Program is available at no cost to you. If you have any of the conditions listed here or anything similar, that's a condition that you need to manage. They do have health coaches that are specific to that type of condition. And active participation can result in incentives such as free office visits, free lab work, and more. And so HMP Conditions Management Program, you can enroll right now if you have any of these conditions and would like to get started with that. As I mentioned, a lot of our services are transferring over to new contracts or new vendors starting July 1. But if you do register now, that will transfer you over to the new program as well. In addition, we have case management services. So if you have, you're dealing with cancer treatments, transplant, you have depression or chemical dependency, traumatic injuries, frequent hospitalizations, several opportunities listed on the right. We can provide this case management services through Health Management Partners as well. And it's a collaborative process between the patient, the healthcare provider, and a support network. You'd be assigned a case manager to help you navigate upcoming issues or any issues related to the managing of your particular health case. So like I said, the number is at the bottom of the page there. So for any of the conditions management or case management, you can call them today and they could get you set up on the program. And like I said, it would transfer over to our new program managers after HMP is no longer with us. We also offer the Our Healthy Baby program, again, through Health Management Partners. If you or someone you know or your spouse that you're covering is expecting a baby, anybody on the health plan can participate in this Our Healthy Baby program and receive individual case management. They can receive a couple of ultrasounds as well as educational materials. And we would also provide up to $500 in a health reimbursement account if you participated from early on in your pregnancy through the end of your pregnancy. So there are some requirements or qualifications to receive the full $500. So we encourage you to reach out to them as soon as possible to get signed up for the program. And again, as I mentioned, after July 1, we will be transferring health management partner programs over to the Wellmark Care Team and Pregnancy Support. But if you were to call HMP today, you can get on the program and they will transfer all of those program applications over to Wellmark and your care will continue. We also have an employee assistance program. Employee assistance program provides focused counseling, consultation and referrals, financial consultation, legal consultation, organizational support services, work-life convenience services, caregiver resources, as well as daily living convenience resources. I'm going to really quickly talk about these over the next few slides, but this is another benefit to you, hopefully to support your well-being and the well-being of your family as well. So focused counseling and consultation and referrals, you can receive free telephonic or in-person counseling for you or your dependents, and actually anybody within your household that lives with you, even if they're not covered on the health plan. So these are all the topics, and there's even more. Anything that's might be causing you issues or concern, take advantage of 5 free counseling services and make that step to call our EAP program and get started on that. We also, in regard to financial services, they have free telephonic or in-person counseling for employees and their dependents. So any of the issues listed here or more, if you have issues in regard to financial, they can certainly help you out with that and provide some advice and likely some resources for you. Organizational support and services. Again, consultation is available for you to address, perhaps if you're a supervisor and you have employees and you're dealing with issues such as absenteeism, declining work performance, substance abuse, mental health concerns, workplace conflict, critical incident planning and intervention. They also can help with case management and formal and mandatory referral process, as well as provide assistance to managers to help employees achieve success. All those resources are available to you. And they also have work-life convenience services if there's a need for any of these resources listed on this page, and a lot more. They can just help you find childcare in your area. They can help answer questions about Medicare and Medicaid, or even help you find a home repair service. They have lots of resources across the state as far as access to that. And if you're having trouble finding some resources to help you with daily living, we can certainly, the EAP can help you with that. So our current EAP provider, so for the next few weeks before July 1st, you can call them, that's 800 number, and you can also access the website and access any information that's available. There's lots of online seminars, lots of resources, lots of learning opportunities. And you can also locate an EAP counselor, as you notice on the right-hand side of the page. All counselors must be on the EAP provider list. If they're not on the list, it's possible to get them added to the list, but KeyPro can tell you what counselors in the area are currently on the list. And as I mentioned, after July 1st, the vendor for the state of South Dakota EAP will be Guidance Resources. We will be providing information on Guidance Resources. An email will likely be going out before July 1st to help explain how to access resources through our new EAP program. But again, don't hesitate to reach out to our current EAP program, KeyPro, and call a number there if you need services before July 1st, and they can help you. Information will not transfer over to Guidance Resources, but you can start fresh with Guidance Resources starting July 1st, again with 5 free counseling sessions, just for example, as well as the other services I mentioned. So that's kind of an overview of all the different services and benefits available through our benefit Be Well, Work Well, and Live Well program. I will mention that coming soon, we will have all of our benefit vendor websites available in one location. So that's one thing we're working on for our employees. So you can go to one place and you can find all the different vendors we talked about. And I know I just talked about the wellness or well-being related vendors, but we also know there's lots of different vendors related to your health plan, Wellmark, as well as your vision, dental. So we're hoping to have all of those available in one location. Until then, if you have any questions, please feel free to call our number or to email us, and they will make sure the appropriate person is forwarded the message and we get back to you in a timely manner. Also, please watch for the newsletter that we send out. So we send out a monthly newsletter, usually the end of the first or middle of the second week. We have lots of updates in there, and also go to our website, thebhr.sd.gov. It's important that you are responsible for your benefits and that you keep up on any of the updates and have a full understanding of what's available to you and how to access the services. So with that, I know we only have about 2 minutes left. We'll see if we have any questions. Feel free to put in the Q&A box if you have any questions. And the questions I see here are, looks like there's only one new one since we last answered. What if we are pre-diabetic? Can we enroll in HMP, or does it need to be active diabetes? I would contact HMP about that and ask them what services they might have for pre-diabetes. I'm not certain they will, but they can certainly let you know. And then also with our Wellmark program, starting July 1st, one of our priorities is providing services and resources to our pre-diabetic population. And we won't have the program up and running in July or probably even August, but we're hoping sometime in the fall, we will have a pre-diabetes educational program available. Also through our wellness program, we will have some other opportunities for you to connect with Department of Health programs that are related to pre-diabetes and diabetes. And if you want to specifically find out about those, I can actually message you directly even before our portal is up and running, if you're wanting access to those before August or September. So lots of opportunities. I would just email the benefits email address on their screen, and they will forward that message to me and I can get back to you. And I see we are almost out of time. And I think we've covered all the questions that I see. So I thank you for joining us. And again, reach out to us anytime with additional questions. And welcome to the state of South Dakota.